All right, so we're going to start with the thoracic posterior to anterior mobilizations. So that's central PAs and UPAs. So obviously you want to find the spot where you want to go. Now in the thoracic spine, because of the way that the spine's process is situated, once you find the level that you want to be at, if you're going to go to the spinous or the transverse process, you're going to need to go up to and over 1 relative to the spinous process. We'll start with the CPA. So I find the place I want to be. Now, the grip that I like to use on this one is a saddle grip. So I'm going to use kind of the heel of my hand, take the other hand and create like a little man riding on a saddle, right? And that's going to be my mobilization point. So I'm going to find my spot. It's going to be about T4, T5. I'm going to get right on that spinous process. The heel of my hand goes right on it. Take the other hand, create that little saddle. Optimally, when you're mobilizing with these, you want your force to be perpendicular to the body. So I'm really going to kind of get up over the patient. My arms are not completely locked out, but pretty straight, and then I'm going to use my core musculature to create the mobilization, right? So you can see I'm not pumping like I'm doing CPR. I'm using my entire body. That's going to keep you from getting tired. It's going to keep your arms a little more loose, and it's going to be more comfortable for the patient. You control it a little bit better. All right, so we'll go into UPAs as well. So again, if you want to find the correct transverse process for that articular column on the thoracic spine, if I want T5, right, I'm going to start at T7 and go 6, 5, and then over 1, and that's going to be the associated spinous process. Now with this, I like to use the pad of my thumb. So I'm going to take that, find that spinous process or that column, take the other hand, create as much skin-to-skin contact as you can. The more contact you've got with the patient, the more comfortable it's going to be. You're not going to feel thumbsy to them. Take that heel of my thumb again, put that right on my mobilizing thumb, and again, and I'm just going to go up and down. It'll be grade 1, 2, 3, 4, whatever you choose. I think it's also worth saying with this, obviously we work with a lot of geriatric patients, and this is not a particularly comfortable position for a lot of them. So in this one, or the lumbar spine, when we get to CPAs or UPAs, you may have to adjust. I've done this before with the patient in side lying. Like Matt was talking about the other day, I've done it before with the patient sitting up in a chair or at an incline up against pillows. Obviously, you're not going to be able to get as much force, but you may have to adjust it to different positions. So think accordingly about that.